Namaste everyone. Today my topic is health hazards of sedentary lifestyle on human health. So what is sedentary lifestyle? Sedentary lifestyle is when somebody is spending a lot of time lying down or sitting for almost 7 to 10 hours a day without doing very little or almost no exercise. It is important what we do 24 hours a day. According to WHO, almost 60 to 85% of the world population is not engaged in enough physical activity, leading to physical inactivity as fourth major high-risk factor for the global mortality, only surpassed by hypertension, tobacco use and diabetes. So what are the effects of sedentary lifestyle? I think we all are sitting for almost an hour, we are bored. I think so. Okay. So we need some blood circulation. Actually, it is advisable to stand for almost 8 minutes after every 20 minutes of sitting. So what are the different health hazards of sedentary lifestyle in human beings? Everybody knows hypertension, then cardiovascular diseases, early onset of heart attack in youngsters, early onset of type 2 diabetes mellitus, incidences of PCOD among females, obesity and cancer. Besides this, osteoporosis and muscular wasting can also lead to physical disability as a result of frequent fractures or frequent falls. There are other effects on the human health like inflammatory diseases, imbalance in the immunity of the body system leading to recurrent infections in the body. But last but not the least, the effects on mental health. Depression and anxiety have been related with the sedentary lifestyle. There are various mechanisms which are mentioned earlier, but one of the most important thing is this. Physical inactivity due to the sedentary lifestyle leads to decreased insulin sensitivity in the human body, which leads to increased insulin resistance. This results in imbalance between the fat and glucose metabolism. See, this is for all, not for the doctors only. So I have to explain a little bit. So this insulin resistance results in impaired glucose metabolism, resulting in chronically higher blood sugar levels, which results in inflammation and oxidative stress, which result in cellular damage. This also alters the lipid metabolism, resulting in dyslipidemia, with higher level of bad cholesterols like triglycerides, LDL, and lower level of good cholesterols like HDL. So what happens when there is insulin resistance, dyslipidemia, and cellular damage to the inner lining of the blood vessel, which is called as endothelium, results in atherosclerotic plaque formation and atherosclerotic changes in the arteries, which is a stiffening of the arterial wall, resulting in increased resistance to the blood flow, resulting in higher blood pressure. And over the period of time, calcium accumulates along with other mechanisms, leads to further narrowing of the blood vessels, leading to the insufficient blood supply to the heart muscles, which is called as chest pain as symptoms and angina. When there is total blockage of the blood vessel to the heart, supplying to the heart results in heart attack, which is the total death of the cardiac muscle. Similar kind of mechanism when happens in the blood vessels supplying to the brain tissue can lead to ischemic stroke. Ischemic stroke has been related with the deep vein thrombosis, which happens with prolonged lying down conditions like stroke, paralysis or obesity or physical incapabilities. So there is embolization of the thrombus from the veins to the brain and leads to stroke. So what are the other effects of
Healthcare Excellence Diabetology of the Year Mumbai goes to Dr. Devyani Rajendra Sankpal, who spoke to us earlier this morning.
Devyani Sankpal from Mumbai, Malad West. I am running a hospital, director of the Sage Hospital, which is the gynec laparoscopic center, as well as we are taking care of diabetic patients too. So my aim is not to allow my diabetic person to become a diabetic patient by giving proper care regarding diet, exercise, and actually creating awareness among the patients about the disease. What is insulin? They are very confused. What is to be done? What is to, what are the actions to be taken following diet and all. My motto is like, just believe in yourself. So poetry which I wrote, I think almost 10 years back, I would like to share with you. There is always a corner for turning, no matters how weary the way. Just look ahead tomorrow. You will find sunshine is not far away. Believe in yourself from the bottom of your heart. Believe in yourself from the bottom of your heart. Work hard. Be patient. Be kind to others. And don't stop unless until you create your own glorious shiny Milky Way. In the dreams of universe, in the universe of dreams and thoughts, don't try to be another star. Just make knowledge your biggest weapon and keep alive your sterling passion. One day, you are going to achieve your desired destination, no matter how far it is away. Thank you so much.